Hey there, welcome to the Mobility Shop Live. I'm Justin, I'm here at the Mobility Shop. This is video number 2 in our 4-part video series called Recovery Made Easy. We are looking at hip and knee replacement surgeries. Today in this video we're going to be talking about the 3 myths around hip and knee surgery, and we're going to be debunking those 3 myths. So without further ado, I'll get started, jump right in. And if you want to watch the previous videos, they are available as well, so go back and check them out. But this is Recovery Made Easy, 3 myths debunked. First myth is, myth number 1, sorry, is that it is for your grandparents. So that is a myth. It's a myth because, studies or stats have shown that over the past 8 to 10 years, obviously surgeries have risen in older patients, or the number of surgeries have increased. The increase in patients from 45 to 50 years old has increased over 200%. So the reasons for the increase is, there's a lot of varying factors, but one of them is obviously the breakdown of cartilage. The breakdown of cartilage that obviously is the reason for the surgery is seen more in patients that have led more active lives, and obviously we've led more active lives, it seems, than previous generations. So the myth that it is for your grandparents is that it is a myth. People now in their 40s and 50s at an ever-increasing rate are getting hip or knee surgeries, hip or knee replacement surgeries. So definitely myth number 1 is that it's for your grandparents. That is not the case. So if you are in that age category and you are looking for a hip or knee replacement, definitely something you want to take a look at. Myth number two, probably, depending on how you look at it on the list of these 3 myths, might be, it's important. I'd say 2 and 3 are both equally important, but that is of no pain, no gain. So the myth here is that, everyone's, if you've played sports or, if you've done anything in life, it's no pain, no gain, meaning that you want to have pain. Now, the opposite is true. Obviously, pain is a great way for our bodies to warn us of things that might be, issues that might be there. But definitely you want to monitor and manage your pain. We talked about in the previous video, pain management around medication, around mindfulness, meditation, but you definitely want to manage your pain. So looking at pain, specifically, if you are, we're looking at both emotional pain as well as physical pain. Talking about pain here is that talking about emotional pain. So we'll start with emotional pain. So, the one thing here is that you might get emotionally, very, very emotional. So there's a lot of issues around anxiety and different things around, the fact that you've lost your mobility, especially immediately after the surgery, the pain. So you want to be able to manage that pain. But it's also important to realize that pain medication is both your best friend and potentially your worst enemy. So you want to make sure that you're managing your pain in a proper way. You want to make sure that you're not overdoing it with things like various narcotics and different things. So definitely no pain, no gain. It's sort of a myth here in that you need to understand that there will be some pain, but you need to try to mitigate the pain, because that is going to enable you to extend or maximize your recovery. So mitigating your pain obviously through medication, but also through things like meditation or mindfulness will help you to alleviate that pain, which will pain can often hinder your motivation to recover. So we want to try to minimize the pain so that we can maximize the recovery and maximize the make your recovery that much easier. But there's also that fine line of weighing, sort of medication and the, what you need to manage your pain. So looking at pain from a different perspective. The third one is, to me, is, we talked about in the previous video a number of different things. We talked about prehab. The third myth is that of sitting and waiting. So we're going to reiterate exactly what we talked about in the previous video. Go into it a little bit more in depth, but sitting and waiting. So you've booked your surgery. Now it's it's basically you've booked your surgery and that's it. That is anywhere but far from the truth. Basically you've booked your surgery. Now you need to realize that that what you do before surgery is as important as after. So basically some quotes here. You need to prepare clear pathways. We talked about all of that. Understand that this is a life-altering surgery, and you're basically, it's going to be a major, issue in your life. So you need to deal with pre-op stresses and different things. So just sitting and waiting, thinking, I've booked my surgery, I am going to sit and wait for the next 6, 12, 18 months pre-op is wrong. It's definitely a myth. You need to do the prehab we talked about in the previous video. You need to prepare yourself both physically, mentally, emotionally. You need to prepare your surroundings. All of that needs to be prepared to allow you to have to maximize your recovery, to make your recovery that much easier. And there's a lot of aspects around that we talked a little bit about in the previous video. So myth number 3 is just sitting and waiting. So those are the 3 myths that I think are most common. We talked to a lot of physicians, talked to a lot of surgeons, talked to a lot of physiotherapists, people within the community. We see a lot of different patients here. We've probably worked with thousands of patients over the past number of years here at the Mobility Shop, who are going into or have just recently been discharged from a hip or knee replacement surgery. So a lot of experience. These are the 3 myths, often that people talk about that, are, not true. So for video number 3, that's video number 2, the 3 myths debunked, which are, it's for your grandparents, not true. No pain, no gain, not true as well. You want to reduce the pain to allow for better or greater gains, and then sit and wait. Obviously you want to prep for your surgery starting the day you plan or day you think about it. So those are the 3 myths debunked for the Mobility Shop Live. I'm Justin, again here at the Mobility Shop. Be sure to check out video number 3 as we go over 3 exercises or 3 things that you can do in preparation for your surgery, as well as potentially post-op or after in your rehab or during your recovery. These will definitely help to strengthen and do different things to help you out. So be sure to watch video number 3, and then video number 4 will actually go over our Recovery Made Easy program and give you guys some ideas on how you can recover that much easier using that program. So thank you very much for joining me. Have yourselves a great day. And as always, thanks for joining me here on the Mobility Shop Live. See you again soon.